Hey, Dr. Patel.
Dr. Maura, how are you today?
I'm doing good. How are you doing?
Doing well. It's good to see
Good.
you.
Good to see you. Thanks for joining me today. We're going to talk about hair loss, something we're just seeing a lot of. So tell me a little bit about it. What is, kind of or what are the typical causes you see around hair loss these days?
Yeah, and like hair loss in general, even with like hair thinning, hair shedding,
Mhm.
just like the symptom itself, usually I'll investigate thyroid function, um, someone's iron status in terms of storage iron, and if they have any active anemias happening,
Mhm.
about malabsorption of things in terms of GI dysfunction. Um,
Mhm.
Somebody breaking down absorbing food properly that can therefore help with nutritional status and hair growth and skin and nails as well, right? Um, and that would in turn also, we could talk about minerals in that regard, or just like everything, stress. And if we measure cortisol, thinking of, or like a stressful event, like a infection as an
Mhm.
example, stressor to the body,
Yep.
um, seeing a lot of post-infection hair thinning, hair loss, hair shedding.
Absolutely.
Um, so it really depends on, you know, not just, hey, I've seen a lot of hair thinning, hair loss, but
Right.
getting a timeline. And that's what we're really good at in terms of creating a really, um, I'd say a good plan.
Yeah.
Yeah.
And as with all these chronic things, right, they're multifactorial, right? So sometimes it's not just thyroid or just iron. It's a confluence of things and they all tend to inform each other and interlink. I mean, hormones, right? That's another big piece that we see, the imbalance of estrogen, progesterone, testosterone. Our menopause patients often have hair loss because of that plummeting estrogen. So it gets
I've
a
been
little complicated. Yeah.
seeing it with all genders, and honestly, even like post-infection again as a stressor can also trigger some sort of like autoimmunity,
Yeah.
going back to immune markers in our testing and really taking a deeper dive
Well, then,
overall.
and yeah, that phrase, I like that phrase, deep dive, especially with thyroid, right? We get patients who their TSH comes back normal, but they know that there's something wrong with their thyroid, right? And oftentimes when we do like really comprehensive blood work and micronutrient testing, we see where that's coming from. So
The extra testing
yeah,
can really make the difference, and especially antibodies too.
antibodies, right? Exactly, big time. And how long does it take usually for people to see the shedding to stop and then the hair regrowing again?
I mean, that can vary a lot by individual, but on average, just in general, anywhere from like 3 to 6 months. But
Mhm.
something as like straightforward as iron, for example, then somebody will see hair regrowth pretty quickly, but it just depends on the individual.
Right. And if we can get to the root and really treat it directly, I always say like this can just be speeded up. That time frame of 3 to 6 can speed up. So
Correct.
it's a good news.
Yeah.
So
Yep.
cool. Thanks so much for joining me.
Yeah. Always.